The disease is carried by the source of life, water, and it can lead to death in 3 to 4 hours. Cholera is currently a threat in Kenya following the March to May long rains that submerged many parts of the country and claimed dozens of lives in the crowded slum settlements at the Kenya's capital, Nairobi. Water sources were contaminated, prompting the spread of cholera that hit parts of the city with a deadly effect. Helen Edengwa, a resident at Biafra slum in Isili, south of the capital, is one of the survivors of a cholera outbreak that killed 5 people in her neighborhood.
Venye kulianza, kuna maji ilituingililia. Sasa hiyo maji kuingia tukakaakaa kwa siku kadhaa nikasikia niko mdhaifu. Hiyo udhaifu ilianza Wednesday mchana. Hiyo Wednesday mchana nikasikia naumwa na tumbo. Sasa nikaenda private hospitali ya private nikatibiwa, wakanipima choo, wakaniambia ni hiyo.
Since December 2014, cholera has spread to 15 counties, an indication that the disease is highly contagious and deadly. As of June 2015, about 4,295 cases have been reported with 81 deaths. The Ministry of Health is working with support from UNICEF, the World Health Organization, and other agencies to control the spread of the disease. The Director of Medical Services, Dr. Nicholas Muraguri, emphasizes that communities should be empowered to realize that simple practices such as washing hands or boiling water play a critical role in preventing cholera.
We currently have an outbreak of cholera, which is basically narrows down to the issue of hygiene sanitation. So we are going out in the communities to really emphasize the critical role of water and sanitation. No Kenya should be dying from disease we can prevent or treat. And that means that we need to empower both parents, community leaders, children, so that every one of us play our role to ensure that people do not die from preventable illnesses.
Community health workers have been engaged through the Health Promotion Unit to sensitize communities about home hygiene and sanitation, as well as encouraging vulnerable groups in the slums to take control of their health. In Mathare slum, for example, community health workers have mobilized a cleanup exercise. They clean roadside trenches, collect garbage and spray stagnant waters, and clog the poor drainage systems in an effort to stop further contamination. They also learn cholera preventive measures, how to dispose human waste, correct ways of washing hands, and water purification.
The main target of today's activity was to sensitize the community on cholera. Recently, remember, we had the cholera outbreak, which has been contained, and this is the area that was affected. And today was the day that we was coming to sensitize them on the same, and actually even to measure their knowledge and to keep reminding. These are community health workers that need to be reminded.
Once the community health workers are equipped with all the necessary training tools, they educate people along the streets about hygiene and sanitation. With banners, they illustrate proper ways of hand washing and water purification. They also go house to house, knocking on doors and emphasizing the importance of cholera prevention face to face.
Mimi nimeelimika juu yenyewe si mingi nilikuwa najua. Sasa after nimeambiwa hivyo cause pengine naweza toka choo nikinawa mimi unawanga kwa karai. Sasa nimeelimika nafaa kunawakaa maji na mwagika. Hapo nimeelewa pia. Pia kufunika chakula sometimes nisahau kufunika. Sasa nimejua pia yenyewe pia nafaa nifunike.
In situations like this, children are most vulnerable, and schools have been made part of the cholera preventive awareness campaign. Engaging communication for development interventions during cholera outbreaks is critical. It ensures focused and relevant, action-oriented information so that people in affected areas know how to protect themselves and their families. This can have direct and immediate impact on reducing the severity of cholera.
We have received financial support from government of Japan and European Commission, and we've been able to address some parts of the cholera outbreak. Engaging the communities is actually the only way we can prevent cholera from happening, and also it's the way of ensuring that the affected children or their parents are accessing the treatment early enough.
Now we are talking about cholera.
Community dialogue is one way of getting a positive behavior change in cholera prevention. However, there is need for a long-term strategy to empower communities to create a disease-free environment where people can access clean water and sanitation.
In the short term, we want people to have certain level of hygiene and sanitation that are critical to prevent this type of disease like cholera and diarrhea. In the long run, we need to address the issue of sewage, access to sewage services in these slums. At the same time, access to clean water. Bottom line is about accessing clean water, and people have a more advanced view of disposing wastes.
We have talked a lot on cholera through the print and electronic media, but that is not enough with regard to ensuring that should there be questions by the communities or the wananchi or the public, we are there as the health educators to answer the questions that they may have or the concerns that they may have.
Several months since the completion of the community engagement exercise, no cases of cholera have been reported in Mathare slum, an indication that it is possible to empower the community to successfully fight the disease. However, the presence of risk factors for cholera still exist countrywide. Working together with communities, with the support of the government and partners, we can reduce these risk factors and eradicate cholera in Kenya.